Okay, first I'm going to start by introducing myself to the patient. My name is Juna and I'll be doing a assessment on you today. Can you give me your name and date of birth, please?
Nidalyn Carriazo, January 1978.
Good. Okay, so as I said, I'll be doing a head to toe assessment on you, and I'm going to focus on your abdominal area, and then I don't need to provide gloves because I don't think I'll be doing anything invasive that requires gloves. So first I'll start off by checking your eyes. You can look straight ahead. Okay, good. And then I'm going to check inside your nose. Can you say ah for me? Okay, good. So the mucous membranes are pink and moist and intact. Her pupils, perla is intact. And next I'll be listening to her lungs, and her oxygen is good because the OT or the pulse oximeter indicated that it is greater than 92%. Have you had a cough recently?
No.
Okay, good. We'll start by listening to your lungs on the front side. So take a deep breath with me. Okay, good. Okay. All right, two more. All right. Her lung sounds indicate no adventitious sounds such as wheezes, rhonchi, rales, and crackles. And then I'll be listening to her heart. I don't know why I took this off. Okay, I'm gonna listen to 5 points of your heart. So we'll start with the aortic. You don't have to do anything. Pulmonic. And then urge point. And then tricuspid. And then, yes. And then mitral. That's good. And then we will be doing her abdominal assessment, and I will be doing my focus assessment there. So first, I would assist my patient into a supine position with her knees bent or in her arms by her side or across her chest. Provide a warm, private environment. And then I would start the assessment with inspection. So I would check her abdomen to see if her skin is intact, check the shape to see if it's flat, see if there's any ecchymosis, striation, peristalsis, and then I would move on to auscultation. So we would start with auscultation because we want to prevent any false bowel movements or sounds from palpation or percussion, and we want to we'll start in the right lower quadrant because that's where the the ileocecal valve is opening and closing, and we want to auscultate in the right lower, right upper, and right lower, or left lower. So we want to listen in each quadrant for a minute each. Okay. Normal bowel sounds will be 10 to 20 or 10 to 30 a minute. Hypoactive would be less than 10 per minute, and hyperactive is greater than 30 a minute. And if there are no active bowel sounds, then we would listen in each quadrant again for a full 5 minutes to indicate that, or to ensure that there is no true absent bowel sounds. If there is, this is a medical emergency. And then we'll move on to percussion. So we're going to percuss in the same pattern as we auscultated. So this. And then you would hear tympani over dullness, and you would hear dullness whenever there's a fluid-filled or solid organ present, such as the liver. And then we want to move on to palpation. So we want to palpate again in the same pattern. So we start from light to deep palpation and stop palpating if there's any pain noted by the patient. So this. the abdominal focus assessment, and then we're gonna move on to the rest of the assessment. And so my patient has no catheters in. Next I'll check for her skin trigger. So can I borrow your hand? So we're just gonna pinch the skin, and the skin returns to baseline within 2 seconds and indicates that there's no tenting and she's well hydrated. And then I'm gonna inspect her arms bilaterally, so she does not have any IVs in. We'll check capillary refill on both hands. It returns in less than 3 seconds. And then we'll do the pulses next. So I'll check her brachial pulse on both sides. And then her radial pulse right here. Okay, both pulses are 2+ bilaterally. And then we'll do a musculoskeletal assessment. So I'm gonna have you check her range of motion first. So I'm gonna have her extend her arms out, abduction, you can stand up, adduction, and then circumduction. All right, I'm gonna have you hold your arms out again. I'm gonna test her strength. So don't let me push down, don't let me push up. Okay, good. You can keep standing for this. Next we'll move on to her legs. We'll check capillary refill on her toes on both sides, and they return to baseline in less than 3 seconds. That is intact. And then we'll check her pulses. So her pulse, we can check pulses on the femoral site, popliteal site, posterior tibial site, and dorsal site. Sorry for my dog. And then we will check for any edema. So I'm just gonna slightly raise her dress, palpate. There is no edema present on her legs. Then we'll do a musculoskeletal assessment. So we're gonna have test her range of motion again. We're gonna have her abduct her leg like that, and then adduct her leg, and circumduct. Then we'll test for strength, so you can hold on to the edge if you need it. So I'm gonna have you hold your leg out. Don't let me push in. Don't let me pull. Okay. And then I'll have her sit back down, and we'll assess her heels. So her heels show no signs of impaired skin integrity or skin breakdown or any signs of ulcerations. And then we're going to move on to the back side. So I'm going to listen to her lungs again. So I'm just going to listen to a couple of spots on your back. So you can turn to the side. So deep breath. Again. Alright, and 2 more. Alright, and on the posterior side, there are also no adventitious lung sounds. And then while I was checking her lung sounds there, I checked her skin as well. Her skin also is intact with no lesions, lacerations, ulcerations, anything of that nature. And then we'll just do a generalized assessment. So I'm gonna check her skin. So there is no edema when I press down. Her temperature is warm. Her skin color is appropriate for her race and ethnicity. Her skin is adequately moisturized with no excessive dryness. And there's also no scars, incisions, or wounds present on her skin anywhere. And then she also has no drains or tubes coming out of her chest or arms or anywhere else on her body. And then I would lower her bed back down, back to safety, the lowest locked position, raise the bed rails up, do the rest of my post procedures. And I'm going to thank my patient, and then I will document the assessment. Thank you.